welcome. This is the technical assistance webinar for the request for applications for the North Carolina Farm Worker Health Program 2021-2022 funding opportunity. And we're so glad you all could be with us today. We are just asking, if you haven't already, if you could type a quick message in the chat just to introduce yourself, say your name and your organization. And this will help us remember who all was here and know if we have any new applicants or returning applicants. So what we're going to cover this afternoon is just the checklist of all the materials that you will need to submit with your application for funding. And we'll go a little more in depth on some of the application content and specifically talk about some tips for the new application format, since this year applications will be submitted via an online platform called Qualtrics. Tara Tyson, our financial specialist, is going to give some tips for the budget that you'll submit with your application. And we'll have just a couple minutes to hear from Rocio, our behavioral health specialist, and she'll talk about integrating behavioral health services in your application. And we should have a good amount of time for some question and answers at the end, if there's anything that we don't cover throughout. But feel free to type questions in the chat as we go along, and I'll try to pause before moving to a new section and try to answer questions as we go. So we'll go ahead and jump right in with the application checklist. So hopefully everyone knows that the applications are due January 28th and all submit via Qualtrics. So what you'll need to complete are the application with some narrative questions about your program, completed budget, assurances page that will ask the director of your agency to sign, the continuous quality improvement and goals tables, which those, just like in years past, we'll send those out to you with your previous year's data, so those can inform your next year's goals. We'll send those to you the week of January 11th. Once all the 2020 data has been compiled. We'll also ask you to submit an internal control questionnaire. And for those of you that use personal vehicles to transport patients, we ask for proof of vehicle insurance, unless you are from a health department. So health departments do not have to submit that, but other agencies will. And all of that you can submit via Qualtrics. I'll show you in just a minute. For new applicants, I don't think we have any new applicants on this call, but since we're recording it and it will be on our website, I'll share for any new applicants that there's just one additional step. We'll ask you to submit a letter of intent form online, and the link to that form is on our website. And we ask for those by December 15th. And then if you are invited to complete a full application, we'll send you the link to that application once we receive your LOI. And again, the link to that LOI is on our website. So that's an overview of what will need to be submitted as part of the funding application. I now want to spend some time talking about the main change for this year, which is the format. So we're using an online platform, it's called Qualtrics. And the reason for this change, it's something that the Office of Rural Health is doing as a whole across all our different programs, moving to this online application format, because it makes processing of the applications and issuing of your contracts more streamlined and efficient. It's just a lot easier to manage all of the information that you send us if you submit it through this online tool instead of having it across multiple Word documents and PDFs. And we also hope that this new format will be smoother for you all as applicants. I know that the fillable Word documents can be tricky. So yeah, other programs have already used it and it's gone well, and we hope it will go well for us. With any change, there's always a little bit of a learning curve. So if you have, any challenges with Qualtrics, please just let me know and we can work through it. But now I'll go through just some tips to hopefully make the process a little bit smoother for you. So I'm going to bring up the application. Hopefully you all are seeing my my internet browser now, and you can see the application table of contents. Stop me, Zoe or Tara, if not. So if you're a renewal applicant, you should have received an email from me with an application link that's personal to your agency. If not, please let me know. And if you're a new applicant, you'll receive the link to this application once we get your LOI. So that personalized link that I sent you, that can be shared amongst multiple people at your organization. So if you have different people working on the application, if you're the administrator, you can work on it and then send the link to your outreach coordinator to add information. You can send it to your finance person. The link will work from multiple people. We just recommend that you only have one person working on the application at a time. And that's just to ensure that all the information gets saved. So all of these tips that we're going over today are also written out here in the application in this welcome and tips page, if you want to find them again later. But I think to illustrate some of the other tips, I'll kind of walk through the application a bit and talk as we go. So the actual content of the application should look pretty familiar to renewal applicants. It's very similar to last year's. It starts off with the cover page, just some, basic information about your organization. And in Qualtrics, you can work on the application in multiple points. You don't have to fill it out all at once. What you would do to save your work, there's no button that says save. You just need to click next to move to the next page, and that will save your work. The other thing to note is that it's going to, if you try to move to the next page, on your end, it will stop you and ask you to fill in all of the questions that are required. So you're going to have to complete one page before saving and closing your session. And the reason for that is to just make sure when you submit your application, it's complete and there's nothing missing. I've disabled that here for this preview mode just to make it easier to jump around and show you. But if that makes it challenging, if you don't want to have to fill out all the questions at once, or if you're trying to jump around and just see all of the application or all of the questions that are in the application, on our website, pull it up here, there is a Word document that's a copy of all the questions. So you can use that to refer draft responses. If you just want to get a glimpse of everything that'll be asked, you can use that as a tool. Okay. So once you move from the first page, if you want to return to that table of contents, you can just look in the top left corner of the screen, these three blue lines, and that'll open the table of contents for you. And you can use this to jump around. Again, we recommend you, if you are wanting to look at the whole application at once, use the Word document so you don't accidentally skip a section. But this is here as a tool if you need it. If you ever want to return to those tips, They're there on the welcome and tips page. So we'll jump to section 1, and that's that message you'll get that you have to complete the questions before moving on. But I'll skip that here. So section 1, this is where the kind of narrative portion of the application begins, and we'll ask you to describe the area that you're proposing to serve and the needs of the population in that area. The questions here are pretty similar to years past. The main difference is that you'll see there's a on COVID-19 in these questions. We really want to hear about everything you've done this year to respond to COVID-19 and what your plans are for next year in order to continue trying to make healthcare accessible for farm workers in the context of this pandemic. You'll also see in this section there are character limits for the responses, and Qualtrics will help you. It will tell you how many characters you have remaining. So that's a nice feature that we didn't have in Microsoft Word. And this first section has 11 of these kind of narrative questions. Yeah, I think that's all we need to say about section 1 for now. The next section is the strategic partnerships section, which should also look familiar if you've completed this application in the past. Again, since the focus is COVID-19, we're going to ask you to talk specifically about partnerships with county health departments and emergency management, since those are so important in COVID-19 response. And then there's a third table that you can choose. If there are other types of organizations that you partner with that you think are relevant, you can include those here as well. Okay, and the purpose of that section is really for you to be able to demonstrate that your agency is efficient and makes efficient use of resources by leveraging partnerships and tapping into existing local resources. This section on access to health services is pretty much identical to years past. We just ask you to tell us about the primary care services that are available to farm workers through your agency, and we ask about cost and hours of service so you can demonstrate that they're accessible to farm workers. And then we also ask, in addition to primary care, about several other types of services that HRSA requires all of its grantees to provide to patients. And so these can be services that are provided either directly through your agency or through referrals. So if you don't have diagnostic radiology in-house, we want you to list out the organizations in your area where you would refer farm workers to if needed, and the counties that those agencies serve. So that's, again, similar to last year. This is a section where it might be helpful to look at the Word document so you can see all the different types of services that we're asking about. The next section is just some more contact information from your agency, especially if you are requesting medical funds. We'll ask for contact information for your CQI team. That's similar to last year as well. And then this is where you'll attach those other materials that are part of the application checklist. So the budget, this year you'll still complete the budget in Excel, just like in years past. We'll just ask you to enter your total budget request in this box and then upload the completed budget template here. And that budget template is available on our website. You can find it in the sidebar here. And Tara's in a few minutes going to talk more specifically about the budget. And just again, you'll complete the goals table and CQI table in Excel and upload it here. And we'll send that to you with your 2020 data as soon as we can, probably the week of January 11th. This is where you'll upload the internal control questionnaire. And we ask for the Excel file and a PDF signature page. So those are two documents that you'll upload here. Same with vehicle insurance. If you're, like I said, if you're using staff personal vehicles to transport patients and you're not a health department, we need proof of vehicle insurance. And for this one, if you have multiple documents to submit, Qualtrics will only let you submit one file. So we just ask that you combine all your documents into one PDF, or you combine all your files into one zip file. And then lastly, this is the assurances page that your director will sign, and they can do that directly in Qualtrics, which is kind of a nice feature. And then once you've gone through the whole application, it will bring you back to this table of contents page, and you can see the sections you've completed will have a check mark next to them. So this is where you can review and make sure your application is complete. And if it is, there's no submit button. But once you're on this page, you'll see this message here. If you click next, it will submit your application. And it will bring you to this page. You can see a summary of your responses. And if you want to, you can download a PDF copy of your application just for your records. So I will pause here and see if there are any questions about the application or Qualtrics so far. There's a question in the chat, has the internal control questionnaire changed? No, it has not. Yeah, it's the same as last year's. Okay, well, you all can be thinking of other questions. We'll have time at the end too for some more. I'm gonna, let's see. Is it possible, there's another question that came in. Is it possible to accidentally submit before all forms are complete? If so, what do you do? I think that we have built in that content validation that's going to stop you before continuing. So I think it would be hard to submit without having it be complete. If you do somehow, just let us know, and we'll figure out another way to get whatever wasn't included. We'll also be checking your applications as they come in, and if we see anything missing, we'll let you know. Okay, good questions. Any others before we talk about the budget? Okay, Tara, I will pass it to you.
Can you see my screen?
Yes,
Okay,
it's a little
great.
bit small.
Zoom in a little bit for you. Better?
Yes, that helped.
Okay, good. Okay, hello, I'm Tara. I'm the financial specialist with the Farm Worker Help Program. And I'm just going to go over the budget template for the 2021-22 fiscal year. So as you can see, the budget template is the same. We still have the same 4 tabs: personnel summary, budget justification, and budget guidance. There are no significant things that have in more detail a little later. One of the things that we will caution, we still would like you to go to the budget justification and the budget guidance tabs first and review especially the budget guidance tab before you start doing your budget. Okay, so let's just pretend I entered some numbers here because I'm a visual person. So pretend I went to my budget guidance and I read it really fast. Of course, you wouldn't read it this fast. We would want you to read it line by line. And I also went to the budget justification to familiarize myself with what was there. Of course, you should have nothing there yet. And so now I'm just about to start my budget. I'm on the summary tab. The first thing that you will notice on the summary tab, which kind of ignores some of my numbers that are already here because we'll get to them in later detail, is we'll talk about other revenue. So if you have patients that pay a copay, you need to estimate about how much that they will pay for their copays each year. So let's say, and then some of these numbers, keep in mind, are all of these numbers are fictional. So you may or may not, yours may be higher and or lower depending on your circumstance. So for this particular year, I estimated that the patients would pay $500 in copay. And you should also, some organizations also have like in-kind contributions, which is like if someone donates their time, if someone donated, let's say, some supplies or some goods to you. We also need to include these numbers on your budget projections, just like you did in prior years. So for this estimate, I pretended that, let's say, we had a volunteer that came in once throughout the year to help us, and the estimate of their time is like $350. And then I estimated that someone, let's say, donated a ream of paper to us, and I estimated that would be $100 for the year. So my total in-kind, but my total patient revenue, other revenue, which would include my patient co-payments as well as my in-kind contributions, is $950. And you'll see that as in other years, like the formulas are pre-built into the spreadsheet. So in D15, you'll see that the spreadsheet automatically calculated the $950 for me. Okay, so before we start going to our project revenue, which is kind of getting into the details of your budget, I want to make some notes. This year, we understand that COVID has kind of taken us for a change, and we know that we've received COVID funding from HRSA. At this time, we do not know if we will receive COVID funding in the 2021-22 fiscal year. However, we encourage you, if you have COVID-related expenditures that you anticipate going forth in the next year, that you include them in your budget, because we don't know, we may receive funding, we may not receive funding, but if those are part of your program, we want you to continue to include that. And we'll just wait and see. We'll find out more probably during OPR. We can give you some kind of idea. But as always, just project whatever you need. If there's a need for it, project and include it in your projections. So I'm going to switch over and go to the personnel tab really quickly in my fictional budget. And I'll start with like my enabling staff, because you'll know for personnel, there's like your enabling staff, your medical staff, your behavioral health staff, and your administrative staff. So with this example, I have 2 enabling staff. I have an outreach coordinator and I also have an outreach worker. Both of these people are estimating to spend 100% of their time, which is like estimated at 2,080 hours on this project. So as you can see, I put a 1.0 because that's like 100%, 1 FTE for both Maria and Amy. And then in columns C11, B and C11, I calculated their annual salary, and this is with a projected 2% increase. But we projected that they get a 2% increase for the next fiscal year. We encourage you to include your projected increase. Of course, if you have a projected increase that exceeds 5%, we'll need justification for that. So for Amy and Maria, you see their salary. I just do Maria, and then you kind of watch through Amy. So Amy had a salary of $42,840. Allocated to the grant would be $42,840 because that would be 100% of Amy's time. Then let's say Amy's benefits, her total benefit package would be $87.82. Of course, with Amy, we'll still allocate $87.82 to the grant because she's 100% fully funded on the grant. So the total allocation for, I'm sorry, Maria, I said Amy. For the total allocation for Maria would be $51,622. And she's listed as enabling staff. So I'll kind of just go through one other person. I'll kind of switch over to the budget because I want you to see, of course, as in prior years. So for our medical staff, we have Ann Leahy, who's a physician assistant, who's dedicating 50% of her time. So that means that Ann is going to be, she's not dedicating 2,080 hours to this project. She's dedicating 1,040 hours to this project. So we would take Ann's annual salary of $81,000 and take 50% of that. Sorry, there's a problem with my formula. Sorry, I got myself. That would be $40,500. Okay, so for Ann's total fringe is $91.14. We would take half of that because she's a 0.5 FTE, so that would give us $4,557. So the total allocation for Ann would be $45,057. Excuse me. So let's pretend that, in my example, let's say that I'm going to hire a behavioral health specialist, but I don't have that person yet in-house. So but I still want to project for that person because I still would need them during this fiscal year. I just haven't hired anyone yet. You want to make sure that you include vacant, but you include that position in your projections because throughout the year, you will need that person. It's to be determined. You don't know who would fill that position yet, but you still include that position in your projections. And I won't go through it line item by line item, but as this person is dedicating 0.25% of their time, we would take that time, their annual salary, to get their allocation to the grant. The total fringe, you take again the 0.25 because that's how much they would be dedicated to the grant to get the allocation to the grant to get a total allocation. And then you'll see at the bottom, we have Terry Gorman, who's our outreach supervisor, who's dedicating 25% of her salary to the grant, $60,000. Her allocation is $15,000. Now, sometimes it just depends. This person who is that, sometimes it could be someone like, depending on your organization, it may be someone like a CEO who's dedicating a portion of their time, or you may have like a in-house accountant or something that's dedicating a portion to their time. Sometimes these people may take their time from your F&A. Like some organizations will charge us like 10% F&A, and they may take, let's say, Terry's salary or the CEO's salary may come out of your F&A. But in this case, Terry decided that she was going to charge it directly to the grant for her time. So you can see the 0.25 times the 60,000 would be 15,000. Her fringe benefits 12,300. She's taking 0.25% of that. That's $3,075. So a total allocation of $18,075. So I'm going to go back to my summary. And as you'll see, the 2 FTE for my enabling staff is actually for my outreach coordinator, Maria, and also my outreach worker. And those numbers will automatically project here. The salary amount, the totals will automatically project. It's just like a formula that draws it in, so you don't have to worry about it. It will automatically project the fringe. But right here, I had another enabling staff, which was not listed on the personnel tab, because the personnel tab is like your salary people. But this person is outreach coordinator that we're going to hire to contract with us for, let's say, half the hours of FT, a full-time FTE for 1080 hours for $14 an hour. And you'll see we projected the hours and then the funding request for the total amount, the number of hours, time to rate times the funding amount. Then one thing I wanted to talk about with travel was the travel weight for this year is 0.575. Of course, we know this is probably going to change in January, but we don't know what that will be right now. So we'd ask that you include the rate the current rate, which is the 0.575 times the number of miles to give you like the $6,900. Then we have patient transportation costs. We're estimating that to be $7,000. We have our patient professional development, and this is a new change this year. There's a star here. I want to let you know about that. So in prior years, the amount for professional development has been estimated at $1,400 maximum per person, per FTE, like full-time FTE. So we have two full-time FTEs from the outreach worker and the outreach coordinator. So this year that has changed. It will be $1,100 per FTE as a maximum. So we did our 1,100 times our two FTEs, give us 2,200. Then I have patient education outreach materials, which are 600 times 0.6. It gave me the 360. So my subtotal for my total enabling cost, which includes my employees, my FTEs, and my contract worker, would be $121,973. Okay. Does anyone have any questions so far before I continue on to the medical services? Okay, so I didn't see any questions, so I'm going to continue on. So for my medical services, remember we had a PA, and the PA salary came, and it tells you that that carries over from tab 1, which we had her for halftime. So she's $40,500, and halftime of her fringe, which is $45.57. But then we also have an RN who's dedicating a portion of her time, her hours. This registered nurse is giving us 60 hours at $30 an hour. So the total funding request is $1,800, which we'll see right here. Then we get into our medical services, which would be like your medical encounters, as well as your medical supplies. We have medical encounters. We're estimating 100 encounters at $100 an encounter. And we ask that you, as in Simulus, that you kind of fill out how many encounters you estimate and then the total cost to give us the $10,000. Then we're estimating that we'll get 40 labs at $40 an hour, $1,600. Now, one thing that I would what I would caution you on is don't underestimate. Like, I wouldn't want you to put like for medical encounters that you anticipate 50, and then you have 150. Because then you would have a case where you underestimated your budget, and then you may need a budget amendment. And we don't know how next year is going to go, like funding wise. So do your best guess estimates for all of your expenditures. Again, with X-rays, 10 X-rays at $75 an X-ray, $750. Medical supplies, we have $500 times $2 a supply, which will give us $1,000. And then the malpractice insurance, and this malpractice insurance is for the registered nurse who will be working a portion of the time on the project. Okay, so anyone have any questions about medical supplies? Okay, so I'll continue on. Then we have the behavioral health services, and then this also carried forth because I think if you remember from the personnel tab, we had a behavioral health specialist on this project. But then as you notice down here, it says behavioral health temporary and contract staff. We didn't have anyone. So if you don't have anyone or you don't have a position, it's okay to leave it blank. We encourage you to leave it blank. And then we also, in this case, we estimate some professional development for our behavioral health staff of $800. So our subtotal for behavioral health expense would be $20,683. And then we have additional patient services, which are our dental encounters and our vision encounters. And as you see, we had 7,000 for dental encounters, 1,400 for vision encounters to give you 8,400 for other additional patient services. And for administrative services, this is the salary for the outreach supervisor, which, as I said, sometimes this may come if you're charging indirect costs. This may be a portion of your facilities and administrative costs. But for this particular grant, let's say they're not charging indirect costs, or they're not going to use their indirect costs for that purpose, then this person has charged 0.25 FTE, 15,000 plus the fringe of 3,075. And then there are other administrative costs that you could have, such as utilities. You could have office supplies, which is a maximum of 300 per FTE. So we have the 2 outreach staff. You may have postage, or you may have anything else for administrative expense. And then you would add that here to give you a total of $19,475 for administrative expense, which includes the supervisor, to give us our total budget of $231,038. Okay, so if we go back here, we see a total grant request of $231,038. So this should match, of course, well, these are formulas, but just to give you a check, you can say, does this match this? Does the 231 match here? But if you'll notice, you'll see at the bottom, we have total revenue of $231,988. That's because it also includes your patient copays as well as your in-kind contribution. One thing I wanted to note for medical supplies is the $2 per patient was based on the 2019 total patients. And we know that 2020 has been a rather unusual year with COVID. So we would say you could use your 20, because the information on the template says to use your 2019 total patients. But we say you can use either 2019 or 2020, whichever is higher for your patient totals. So then for the budget justification tab, this is where you just give us some more information. And as you can see for like my staff, I said that they got a 2% increase, alignment with our agency salary policy. And then I just told what their salary went to, where it was, and then where it was now, where it was previously, and then where it was this fiscal year. I told what we need our medical services for. You know, we have someone, we're going to have a mobile unit that we use in the evenings. I talked about what supplies we would have, and this, if your justification, especially if you have numbers here, it should equal what you said in your budget. I talked about our professional development for the outreach coordinator and the outreach worker, that they were going to the East Coast Migrant Stream. Don't know if that's going to happen next year, but keep hope alive. And then I also talked about for the behavioral health specialists that they're estimating $800. Then I talked about my patient transportation costs. I discussed why I have my malpractice experience from my registered nurse who's working during the evenings on the mobile health unit. And any other expense, like say, for example, if you had something else that was kind of different from our recommendations, you need to justify it here, because we would look here, come here to look. Does anyone have any questions? The only things, again, that are really changing is the $1,100 per FTE for the professional development. Oh, I forgot to make a note. We're not doing fellows this year. Also, you can have staff, you can have interns, but we're not doing fellows. If anyone has any fellows, we're not. Does anyone have any questions? Okay. Well, if not, I thank you. If you have any questions, feel free to reach out to myself regarding the budget, and or you can ask your site consultant as well. And I think Rocio has a portion that she's going to talk about behavioral health services. Is that correct? Kate?
That's right. Thank you,
Okay,
Tara.
great. Thank you.
Thank you, Tara and Kate. Good afternoon, everyone. Thank you for joining us today. I think Kate has talked a little bit about behavioral health services integration as it pertains to the application. And she mentioned something very important, right? HRSA requires us to provide or facilitate access to services. And it's very important that as you do your strategic planning and your application, and Tara mentioned this as well, even if you don't have a person that has been hired or identified, but it is part of your plan for 2021, make sure that you go ahead and integrate the plan in the budget and all the activities that you may have planned for that activity. And just like Kate and Tara, I will be joining several of the meetings as we talk about successes and thinking about next year. So feel free to reach out to me as well, and we can have the conversation about both behavioral services and dental services as it applies to your specific projects. But also, if you have any questions in reference to that right now, I'll be happy to answer them.
Thanks so much, Rocio. Okay. Any questions about behavioral health? Okay. Well, if you think of them, all this information, contact information's on our website as well. You can reach out to all of us with questions as you start working on your applications. One other tip that I wanted to mention is that we just really encourage teamwork as you put together these applications. They're going to be strongest if you've got everyone at the table as you're working on it. So include administrators, include your clinical team members, financial team members, to make sure that you know, the narrative and your plans for program operations are in line with your budget and in line with your goals for the year. So that's one last tip I wanted to leave you all with. Any final questions about anything related to the application or Qualtrics? Okay. Well, thank you all so much for your time this afternoon. We appreciate it. We have recorded this webinar, so once the video kind of processes, we'll post it on our website. So if you had to miss any portion of it, or if there's anyone else at your agency that wasn't able to be here, you'll be able to watch it on our website if you'd like. And yeah, good luck with your applications. Please let us know if we can help in any way. Thanks so much.
Thanks, everyone.
Thank you.
Thank you.